Every day, thousands of people arrive at CMC, the Christian Medical College in Vellore. They have journeyed from all over India and beyond, drawn by the excellence of the hospital's medical services and the reputation for trust and compassion held by its staff. In just over a century, CMC has grown from the small single-bed clinic started by its founder, Dr. Ida Scudder, into a huge modern facility, providing the standard of care that ensures it continues to be one of the finest hospitals in India. Each person arriving here has needs and hopes and brings to CMC their own story. CMC welcomes each one and incorporates their stories into its own ongoing narrative. This is an account of just some of the people who ensure that CMC delivers on its commitment to serve the poor and needy through education, research, rehabilitation, and most of all, medical services. These are our stories, our CMC. Its director, Dr. Sunil Chandy, is keenly aware of the needs and is guiding a strategic response.
I have been given a mandate to respond to the changes and challenges that we see in our country. India is in rapid transition. There's a lot more affordability that our patients have. There's been a social migration from below poverty line to low middle class. There's a changing expectation of people in terms of health infrastructure and the way hospitals should function.
CMC has a threefold response to the health needs of India. Firstly, a commitment to develop and equip compassionate and ethical healthcare professionals through excellence in education and training who can serve the needy anywhere in the spirit of Christ. Secondly, to relieve suffering and promote good health through medical services in the community as well as through hospitals and clinics. And finally, to seek appropriate solutions to health needs through research and innovation. While formal lectures have already started in the medical school, there is a rush at the Nurses' College as the first of the buses leaves for the daily clinics and home visits to villages and communities that surround Vellore. It is here that the student nurses get to experience the hands-on training that is such an important part of all medical education at CMC. Education has been integral to CMC since its inception. The founder, Dr. Ida Scudder, knew that if she was really going to make a difference to the sick and needy, that the training of local nurses, doctors and allied health workers would be essential. Over 100 years later, CMC has an enviable reputation for the excellence of its graduates. With their ward rounds finished, final year med students Baker and Prithviraj have been posted to practice their skills in the main hospital's neonatology wards. At the other end of the ward, student nurses Clara and Shalini have arrived to do some hands-on revision with a tutor. CMC's unique approach to its medical mission is achieved by the nature of the way it educates those who answer the call. Service in the spirit of Christ, relieving suffering and promoting health. Running a huge hospital is not just about finding solutions to medical problems. Dr. Anna Pullimud never imagined that she would help turn CMC green. But discovering that the 12 tons of waste that the hospital and college generated each day was dumped in landfill was the impetus for a project that is inspiring a sustainable future, while having a significant impact on the lives of all those involved. Other initiatives of CMC's Green Team include water recycling, the generation of electricity through rooftop solar panels, and the new space-age dish at the front of the hospital that heats water by harnessing the sun's energy. As well as delivering medical excellence that attracts patients from all over India, the hospital has always encouraged a uniquely CMC approach to both pure and applied research. This has led to many firsts in areas as diverse as leprosy, cardiology and polio, as well as in surgical, clinical and social fields. CMC's research seeks to develop technology and techniques appropriate to Indian situations that save lives and make good health affordable. 8 years ago, Dr. Cherry Kang and her research team made the commitment to try and develop an affordable vaccine that could address the challenges of rotavirus diarrhea in children under the age of 5. After all, 30,000 children a year in India were dying of the gastro disease. How they created their research program and its outcome is a true reflection of the unique way CMC engages with the people and the communities they are committed to serving. Using the research from the community clinic, Dr. Cherry Kang's team has proved the effectiveness of a rotavirus vaccine that is now being championed by the Indian government. The challenges for CMC in the immediate future are most apparent in the hospital's busy accident and emergency department, where resources are stretched to the limit on a daily basis. Dr. Thomas Banu looks after trauma victims from road accidents and other mishaps.
CMC has always responded to the needs of the society at different points in time. This facility is no longer enough for the large number of patients that we are seeing. So to meet these new challenges, we are planning to build a brand new hospital. This is a 1,000-bedded complex which will house the new lifestyle disease departments like cardiology, neurosciences, cancer sciences, and most importantly, trauma, which will open out a service facility for these large number of trauma care patients who come off the roads. It will be designed in such a way that it will be accessible for all sections of society, the poor, the affording, the not so affording.
Of course, Dr. Chandy is only too aware of the investment needed to ensure CMC continues its mission into the future. For inspiration, he makes regular visits to the site of the new hospital at Kanigapuram. This is a tremendous challenge, requiring assistance from supporters, both large and small.
We believe that everything we do, whether it's healthcare, patient care, service of research, is rooted in values that the Christian faith teaches us.